And so we now proceed to the next debate on premature deaths from heart and circulatory disease. I call Dean Russell to move the motion.
Thank you, Madam Deputy Speaker. And I start this with something I never thought that I would be stood here discussing. At 47, as I shared in Prime Minister's Questions a few weeks ago, I shared that I'd had a heart attack. And whilst that happened back in August last year, I must admit it took several months for me to be able to feel comfortable talking about it more publicly, whilst I knew that I was on the path to full recovery, which I believe I feel that I now am. And as I said in Prime Minister's Questions, I feel a bit thinner for it. So that's, that feels a physical response to it. But one of the things that really came through, beyond the fantastic support at the NHS, which I will reference later, and friends and family, and my team, was the support of the British Heart Foundation. Because their resources online and their support and their guidance was invaluable in helping me, when I was on my own, try and find a way through this in the path to recovery and understand the stories of others. So I wanted to hold this debate today, not just to share my own personal story, this isn't about me, but to hopefully raise awareness of the early symptoms, the early signs, some of the areas of prevention, but also some of the challenges that I'll be raising to the Minister for others who perhaps weren't as fortunate as I was around identifying the risks very early on, around the identification of the risks. So I will aim to cover as much as I can in the short time that we have. I know that others will want to speak in this debate, so I will not hog the time. But I'm hopeful that from this, even if just one person comes away from watching this debate, as I'm sure there are millions at home who are following this debate this afternoon, that even if just one of those might spot a sign for themselves or a family member or a friend and hopefully save their lives or change their lives. So to start with, let's talk about the symptoms. Well, for me, and I appreciate they do differ for everybody in a slight way, and the British Heart Foundation has excellent examples and guidance for what these might be. For me, it started in my arm, and I felt a sort of numbness and a tingling sensation in my left arm, and an increasing tightness in my chest. And as that grew, it started to filter back to the back of my body. But it wasn't immediate. And I think, like so many others, often one thinks of a heart attack as a cardiac arrest, and that's where you literally stop and you need a defibrillator or CPR. Whereas with a heart attack, it can feel more like a slow process that happens quite quickly, if that makes sense. And so, as I started to get those symptoms, even for someone like me who had worked many, many years ago with the British Heart Foundation as a client of mine, where I worked on campaigns to talk about symptoms, even for someone like me who knew instinctively what was happening to me, even I thought, I don't want to phone 999, I don't want to waste their time. So I actually ended up calling 111, expecting them to say, don't be silly, take a pill, go to your GP tomorrow and we'll get you sorted out. And they didn't. The message I had back immediately was, an ambulance is on its way. At which point I thought this might be a bit serious. But even then, I was still in a little bit of denial about the situation. And I won't tell the full details of the story, but I was transferred very quickly to Watford General, where they saw me and were exemplary. The East of England Ambulance Service were absolutely incredible at the speed and the compassion and the support they gave me. Same at Watford General, a hospital I love dearly. And then I was transferred to Harefield Hospital, who again saw me very quickly. And I realised during that process the enormity of the situation I was in and the potential that I could lose my life. But the fact that I was unlikely to now because I was in the right place at the right time. Oh yes, please do.
The work of Harefield. My son has been in Harefield for 4 months. He had a heart transplant just before Christmas. So it's been a very traumatic, but I would just like to place on record the incredible support and care that they provide there. And also that we think of heart attacks and heart failure and conditions like that affecting probably people my age and maybe a bit younger and maybe a bit older. but actually heart failure, heart conditions can affect young people as well. And that we mustn't have lazy diagnosis where people think just because somebody's young they can't possibly have heart issues or cancer or other type issues. And so, but as I said, I just really wanted to put on record the great support that Harefield Hospital provide.
Well done. Hear, hear.
May I send my best wishes to the honourable member's son, and from my experience he is in absolutely the right place, and I hope he has a swift recovery. And I echo the comments made that Harefield, the staff were just exemplary in every single stage of the process. And so I'd just like to just again put on record for my own benefit, rather selfishly, my gratitude to the East of England Ambulance Service, Watford General Hospital, Harefield Hospital, but also the cardiac rehabilitation teams, because the experience of being in hospital and having a heart attack was a matter of days, but actually it's a matter of months, where you're going through the rehabilitation, the exercise programs, changing your diet, all of those things that are so important. So it's not so much that I can talk about saving my life, but it's changed my life. And I can't say that I was pleased that it happened, but I'm pleased it happened the way it did, if that makes sense, in terms of making a difference. But I recognise my experience is not unique, and however lucky I am in the experience I've had, and the subsequent opportunity to use the platform of Parliament to raise awareness of the conditions and the work of British Heart Foundation and the NHS, I think it just felt very apt to do this debate this month because it is World Heart Month. And it's an opportunity in these backbench debates to have these conversations and raise the concerns. And cardiovascular diseases include conditions that affect the heart and circulation, including high blood pressure, stroke, vascular dementia, and which I will refer to collectively in this debate as CVD. And over the last 6 decades, huge strides have been made in improving outcomes for those affected by CVD, with the annual number of deaths falling by around half since the 1960s, in part thanks to decades of medical and scientific breakthroughs, and that's where research is just so essential. However, today, I'm afraid, there are more than 7 million people living with heart and circulatory diseases in the UK, causing more than a quarter of all UK deaths. And in 2022 alone, over 39,000 people in England died prematurely of cardiovascular conditions. That's an average of 750 people per week. Just to give that a sense of scale, that's filling this chamber 2 times over. So despite the premature death rate for CVD continuing to fall by 11% between 2012 and 2019, sadly it still remains one of the UK's biggest killers. And I'm conscious that when speaking to the British Heart Foundation, they're doing a lot of work to raise awareness of concerns around waiting lists for heart tests and treatment going up, and we need to make sure that we tackle that head on. There's no room for manoeuvre in this. Let's keep moving forward to make a difference. And of course, more analysis is needed from the life-saving research by, again, the British Heart Foundation. We know the causes of premature deaths from CVD are multifaceted and complex. I know that the NHS long-term care plan intends to look at many of these areas, but I really do call on the government to be bold, to look at coordinated action to address this issue through 3 ways: to prioritise heart care within the NHS, to accelerate vital care, to ensure better protection for heart disease by addressing the drivers and underlying health conditions such as obesity and smoking, and finally, create a research and development ecosystem for breakthroughs, treatments and cures. And I welcome the significant work already underway through the government's major condition strategy and the inclusion of cardiovascular disease in that. The interim report published last summer by the Department for Health and Social Care made clear the scale and urgency of the government's priority to address this issue. But I think urgency is absolutely key here. Around 80% of cases of CVD are attributed to modifiable risk factors such as high blood pressure, obesity, poor diet, smoking, making CVD largely preventable through a number of lifestyle choices. Now, I must say for myself, politically, I'm not one that thinks the state should intervene and stop people from being able to enjoy their lives, but I think education is key to that. And education can come through many different means, but that includes engagement with the NHS and GPs to be able to provide advice. But it isn't about the state stopping people from making those lifestyle choices. But I think it's fair enough to let them know what those lifestyle choices might lead to that can make a big difference to them and their family. Nearly 2/3, around 64% of adults in the UK are overweight or living with obesity, and up to 8 million people have either undiagnosed or uncontrolled high blood pressure. Now, I admit, from my own personal experience, I knew I wasn't going to be running in the Olympics anytime soon. I can't exactly describe myself as an Adonis, but what I would say is that I did know I was slightly overweight, and I thought I'd be okay. I thought, actually, these things don't happen to somebody at 47. Like most of us, these things happen to somebody else, don't they? That's the way our minds work. And so this was a wake-up call for me, but that's why I want to make a wake-up call from this wonderful platform of the House of Commons chamber to others, that don't assume that it's all okay. Get checked out and make sure that you watch out for those signs. So I therefore welcome the government's ambition to halve childhood obesity by 2030 and help adults reach a healthier weight through a range of preventative measures to empower people to take control of their own health. And of course, for everybody, there's different ways of doing that. I won't share my own dietary ways, because I'm sure some dietitian will watch this and tell me that I've got it totally wrong. But I've lost about 2 stone in the past 4 or 5 months. And it hasn't been through fasting, or I appreciate the Prime Minister does his fast each week, so I won't comment. But it wasn't through a fad diet, as it were. It was just through small changes in lifestyle, small changes in the way that I live my life. And I must say, as a Member of Parliament, like most people, we work long hours. My father was a lorry driver. I'm very proud of the long hours that he did, the work that he did to bring up myself. And I look at the jobs that we all take, and this job here isn't particularly physical, but it's long hours, it's quite sedentary at times. And I think that's probably the same for a lot of people across the UK. So being mindful of that and going for a walk, going for a bit of exercise can make a big difference. And the long-term plan, of course, the NHS long-term plan, of course, sets out the government's determination to prevent 150,000 heart attacks, strokes and dementia cases over the course of 10 years. And I, of course, welcome the focus on early intervention to help people live longer, healthier lives. But we all know that within this, smoking is still the single leading behavioural cause of preventable death across this country. And so I'm very supportive of the government's desire for a smoke-free generation by 2030 and pushing forward with the tobacco and vapes bill to ensure that children under age 14 or younger, essentially anyone born on or after the 1st of April 2009, can never legally be sold tobacco products. And by addressing these lifestyle concerns and identifying underlying conditions earlier, it could help to prevent tens of thousands of heart attacks and strokes and support the government's ambition to improve healthy life expectancy by 5 years, by 2035. But actually, it's more than that. In my mind, it means that a child will grow up seeing their father or their mother. It means that somebody gets to see their loved one and their friends and their family into the age that they can call them a grandparent, or they can see them graduate. So this, for me, isn't just about government policy. This is about the impact on real people, the impact to help have someone have a positive life. And of course, when we talk about heart attacks in this way and heart disease and the issues being discussed today, we're talking about premature deaths. But actually, for most people who are affected, it's a restriction on their lives. And that's what I want to make sure that we improve for everyone across this country. So, of course, I'm proud to say that the UK continues to lead the way for medical research, establishing innovative new ways for early diagnosis and effective treatment. And at my own West Hertfordshire Teaching Hospital Trust in my constituency of Watford, which many will know in this place, I've campaigned very strongly to make sure we got all the funding for the new hospital, and that's a proud moment and very important. But one of the reasons why I was so supportive is because I saw the incredible work they did, in particular around virtual hospitals, and they've really led the way in showing that there are other ways to make sure we can support people's health, and especially with that being at home. And the idea of using technology and data to help improve people's lifestyles. And the beauty of the modern age is that many apps now have the ability to give you great guidance on your own health. People have got Apple Watches or Fitbits or whatever is out there. I don't want to sort of go down one particular brand route. But the reality is we're able now to track so much more of our health. But what I think we need more education on is what that data means. We can all see our heart rate, but what does that actually mean in terms of impacting people's lives? So that's where things like virtual care is so important. But I've long argued that we should be looking, and I won't go too far down this route, Madam Deputy Speaker, because it's a different debate, but I do think there's an argument for what I call, which is data donors. So at the moment, sadly, if somebody loses their life, they might donate an organ. But actually, if they could we could donate our data throughout our lifestyles, then we could actually use that so that the NHS and other organisations could start to say, could they cure cancer? Could they use that data in an anonymised way and with all the checks and balances to make sure that's done well? So I'm conscious of time, Madam Deputy Speaker, and I'm sure I'm going over my allocated period, but I just want to highlight that despite all the developments, CVD continues to have an impact on the wider economy, costing an estimated £21 billion annually in England alone. And as I say, behind every figure is a person or a family who've been deeply affected by these conditions. And as part of this process, I was fortunate to work with the House of Commons Chamber engagement team, and they reached out to constituents across the country to share their own experiences in preparation for this debate. And one respondent, and I believe this should be in the House of Commons library, if not, I'll make sure it's shared with colleagues and online, but one respondent highlighted this, and it really moved me. And they said that their daughter has half a working heart. She's had 2 open heart surgeries and will need another. If it hadn't been detected early, she wouldn't be with us today. That's a life, that's an ambition, that's a future that's still there because of the support that's been given. And I must say, I know I'm doing a bit of a plug for British Heart Foundation today, but one of the other comments which I thought was true of my experience was the British Heart Foundation has a brilliant website for facts, and the consultant team we are under at our local hospital in this instance are fantastic. There are many quotes from people giving very similar stories. The common concern, though, and I raised this to the Minister before coming to my closing remarks, and it was a common concern, was concern about aftercare following surgery or medical treatment and the effects of the condition it's had on them mentally and socially. I have to admit, from my own experience, one of the things that you suddenly start to feel all the time are twinges of things and thinking, is there something wrong with me? Is it happening again? My experience, within 2 weeks of having the heart attack, I'd promised that I would go to a local event, and I didn't want to let them down. And I remember going to it, and it was a searing hot day, and I remember genuinely being quite frightened about going out with the heat and with people, not knowing whether my body would still work the way that I hoped it would. And I'm glad I did it, because actually once I'd gone through that experience and being there and really realising I could still be me, I was able to actually overcome that, and I continued to work as best I could safely as I recovered. But not everybody gets that opportunity, and it's very easy when you've had a physical illness, and I think in particular when it affects your heart, is that you suddenly worry that you don't have that control over yourself and you don't know what might happen next. And I must admit, I've had many times where something's twinged and I've thought, is this it again? Thankfully, it hasn't been. But I think that aftercare is absolutely essential. You can fix the body, but actually helping support the mind through that process and the psychology is absolutely essential. And I know from colleagues in the House, they will have even far more powerful stories than mine of the experiences they've had, and I look forward to hearing that later. So it's about multidisciplinary care that doesn't end when the patient leaves the hospital, but it's about supporting their full recovery and also helping them with those lifestyle changes. And I have to admit, the cardiac rehabilitation team I worked with were phenomenal, because with some of the times when I was extremely concerned, they just put my mind at rest, and that meant that physically and mentally I was better. So I therefore asked the Minister if consideration would be given regarding potential counselling services and mental health support to those affected by heart and circulatory conditions. So as I have said, heart and circulatory diseases cause a quarter of all deaths in England, amounting to over 140,000 each year, 480 a day, or one death every 3 minutes. Madam Deputy Speaker, in the time that I have spoken today, sadly 5 people will have lost their lives, and therefore I call on urgent action to do more to protect our hearts. So by prioritising the right action and supercharging the progress that's being made on addressing heart and circulatory diseases, we can improve the nation's health, grow the economy, and give people hope for a brighter, healthier future. Thank you.
It will be obvious to the House that we have very little time this afternoon, and so I hope that members will limit their remarks to around 5 minutes.
5 minutes.
Oh, well, would the honourable gentleman like to find some way to make the House sit longer than it's meant to?
No, Madam Speaker. I was just rather surprised that we had 3 hours offered for this debate. We've actually ended up with an hour, haven't we?
Well, I appreciate the point that the honourable gentleman is making, but there's nothing I can do about it now. Don't we all wish sometimes that we could turn the clock back? But I don't have that power. The question is, as on the order paper, Andrew Bridgen.
Thank you, Madam Deputy Speaker, and I thank the honourable member for Watford for proposing this important debate today, for sharing with us his personal experience of suffering a heart attack, and I'm delighted to see he's made such a strong recovery to be here in the chamber today. I'm sure many members of this House have been affected by cardiac disease, or know people close to them who've been deeply affected by this appalling and shocking killer. The House of Commons library pack for this debate contains a startling statistic. Almost casually it mentions that cardiovascular deaths per 100,000 have risen 10%, after falling steadily for decades, 10% since 2019.
I apologise for interrupting the honourable gentleman, but I have taken to heart what he just said. I've done my best to squeeze out more time, and the honourable gentleman can have around 7 minutes.
Thank you, Madam Deputy Speaker. Yes, that's a 40% increase on previously. Ask and ye shall receive, indeed. So a 10% increase in cardiac deaths since 2019, following decades of steady reduction, following major improvements in public health policy, a reduction in risk factors such as smoking, controlling blood pressure, as well as improvements in medical care. And whilst I'm grateful to the honourable member for Watford for achieving this debate and the other members who will contribute to it, there is an elephant in the room. Indeed, there are so few speakers, there's probably room for a herd of elephants in the room. And that elephant in the room is the question: why has there been a significant uptick in cardiac deaths in recent years? What novel intervention in public health has occurred since 2019? Some might think that COVID is the cause. Not so. The same uptick in heart deaths, cardiac deaths, is observable in both Australia and Singapore. And it happened in those countries before they got COVID, but after they rolled out the experimental messenger ribonucleic acid injection. The jab. I can see some members already tutting and turning away. Everyone knows that MPs with science degrees are few and far between, and some people's eyes merely glaze over when science is mentioned. Well, I'm one of those MPs fortunate enough to have a science degree. The other one was Margaret Thatcher, who, as I recall, was rather more proud of being the first Prime Minister with a science degree than being the first woman Prime Minister, quite rightly so. Since some of those here today appear to have probably prejudged this issue, it is often said that it's easier to fool someone than to persuade them that they've been fooled, and so for prosperity. We must remember it took 11 years after the thalidomide scandal was exposed in 1961 before the word thalidomide was ever mentioned in the chamber of the House of Commons. And I refuse to let this mammoth medical scandal be ignored in the same way. We're witness to the greatest medical scandal in decades, perhaps in living memory, possibly ever, bigger than thalidomide, bigger than the Tuskegee untreated syphilis scandal, where some black people were deliberately not treated to see what would happen to their bodies over time, maybe bigger than the Vioxx scandal, hitherto the granddaddy of medical scandals. And I can see some people looking puzzled. Vioxx was a new drug invented by Merck, and it was an alternative to aspirin, a mild painkiller. A researcher first highlighted the issue to a senior management in Merck in 1997, 2 years before the drug was approved. It would go on that to 1 in 115 people who took Vioxx would suffer a heart attack. Merck's profits from Vioxx comfortably exceeded the criminal fine, the compensation and the litigation costs after it was pulled. It was a good business decision for them. Not one pharma executive went to jail for skewing the trial results, for deceiving the regulators, for recklessly causing the deaths of 60,000 ordinary Americans for profit, Madam Deputy Speaker. Always for profit. Lives tragically cut short, families destroyed, children devastated. Imagine the incentive structure of an industry where profits can be made like that. A corporate greed where they have full immunity from prosecution. In 1986, pharma companies got immunity in the USA for all vaccines. The number of vaccines administered to children in America has exploded since then. I will give way to the honourable gentleman.
Giving way. Does he share my hope that the Minister, when she responds to this debate, will respond to the article in the Daily Sceptic on the 20th of February this year by Will Jones, headlined "COVID vaccines linked to large increase in heart, blood and neurological disorders, major study finds"?
The Minister will, and of course this is going to go on. Already cardiac deaths were the biggest killer in our country, but to have a mysterious 10% increase, and I'm sure the honourable gentleman, as others in this chamber, have witnessed the horrifying sight of super-fit athletes keeling over on pitches around the world. And there is a mountain of peer-reviewed evidence emerging, and some hypotheses are being proposed. There are numerous cardiologists with concerns. Unfortunately, many experts do not feel able to speak out openly over those concerns because of the climate of fear and the consequences of whistleblowing or speaking out against Big Pharma. Big Pharma that have been found so often to have been operating their products not in the public interest and causing harm. And I'm afraid that the rollout of the COVID-19 vaccines will be much the same as we've seen before with Vioxx, with thalidomide and so many other cases. And the evidence is mounting up so rapid, so the flow of evidence, that the only people who can't appreciate what's going on in this country are those who really don't want to see. And I think the public are going to be extremely harsh on this Parliament, our response to the COVID-19 pandemic, the rollout of the vaccines, and the fact that when the evidence was mounted up, we were going to stop vaccinating after the over 70s, then we decided it was going to be the over 50s, and then it was going to be everyone. And this House took the appalling decision in the face of, unsupported by the Committee on Vaccination and Immunisation in September 2021, to appallingly vaccinate children who are at very little risk of COVID, if any at all, but have been harmed seriously by the vaccines. And why we ever used a systemic vaccine for a mucosal respiratory virus, and one world expert said last year, it's not surprising that none of these predominantly mucosal respiratory viruses have ever effectively been controlled by vaccines. He continued, this observation raises a question of fundamental importance. If natural mucosal respiratory virus infections do not elicit complete and long-term protection immunity against reinfection, how can we expect vaccines to work when natural immunity doesn't give it protection? And who's the name of this expert? It was Mr. Anthony Fauci, the former head of the Centre for Disease Control in America, who pushed the vaccines himself. I wish I had more time, Madam Deputy Speaker, This is a huge issue, and we need to be debating this again. It's the biggest killer of our constituents, and I'm afraid, I fear that the rate of increase of cardiac deaths is not going to slow in the UK or in the rest of the world. Thank you.
Philip Davies.
Thank you, Madam Deputy Speaker. It's a pleasure to follow the Honourable Member for North West Leicestershire, as I often seem to do in these debates, which are often resemble Madame Tussauds, with the same faces appearing in these debates time after time. Madam Deputy Speaker, you'll know that I have a reputation for brevity in my speeches, and you'll be delighted to know that I intend to carry on with that reputation now. I do want to congratulate my honourable friend, the member for Watford, for securing this important and rather timely debate, and echo the comments of the honourable gentleman from North West Leicestershire in saying that we enjoy seeing him looking so fit and healthy after the trauma that he had. And this is a really important matter, and he's been right to raise it today. Now, as I highlighted in the Westminster Hall debate last month on excess death trends, a recent article in The Lancet found that while the cause of ongoing excess deaths in the UK are likely to be multiple, ONS data did show some clear trends, and in particular, the largest relative excess of deaths since the pandemic occurred in young or middle-aged adults, with cardiac deaths happening outside of hospitals the most elevated. In other words, young and previously healthy people are dying at home from cardiac-related events, and we don't know why. Now, these are not just numbers and statistics, Madam Deputy Speaker. These are real people, loved ones, often from younger age groups, who are dying before their time. And it's absolutely urgent and our duty to get to the bottom of this sooner rather than later. And there are, as I'm sure we're all aware, many theories circulating for the causes of these excess deaths. One of them is the possibility of a causal link between the population-wide use of COVID-19 vaccines and the marked increase of cardiovascular-related critical events, including heart attacks and strokes, among otherwise apparently healthy people. The fact is, we don't know if that is the cause or not, because the data isn't being released, and until certain data sets are released, it's impossible to rule this theory in, and it's impossible to rule this theory out. That's why I, along with cross-party colleagues, have written yesterday to the Secretary of State for Health and Social Care, Professor Stephen Riley, the Director General for Data at the UKHSA, and Dr Alison Cave, the Chief Safety Officer at the MHRA. We warn that by withholding official data, the Department, the UKHSA and the MHRA are helping fuel concerns and hesitancy about public health. We've asked that anonymised record-level official mortality data be released alongside vaccination dates, doses and comorbidities without delay. Now, we understand, Madam Deputy Speaker, that the MHRA has collected and already shared this data with pharmaceutical companies in order to enable them to produce post-authorisation safety studies for their products. So I see no reason why this information cannot also be shared with parliamentarians and the public right away, and perhaps the Minister can explain if it is the case that this data has been shared with pharmaceutical companies, and if so, why it isn't being shared with the rest of us. Now, as the Minister surely realises, repetitive generic assurances that the Government and the UKHSA take excess deaths seriously and monitor it constantly, and the MHRA have systems in place to continually monitor the safety of our medicines, are not serving to reassure anybody at all. Likewise, the news from the ONS this week that they have revised their excess death methodology, and suddenly there are 20,000 fewer excess deaths last year, has done little to quell public concern. Indeed, if anything, Madam Deputy Speaker, it's done the exact opposite, with people seeing it cynically as a convenient sleight of hand. As we say in our letter, the Government and its agencies, if the Government and its agencies are not willing to share the specific data we've requested, could the Minister explain to us why not? We are all on the same side. We all want to look after people. We're all concerned to do the best we can for everybody. But until we have all the data, we just don't know what we don't know. if there's any potential that public health interventions such as COVID-19 vaccines are causing harm and are causing premature deaths among some people, we must act on that without delay. If the evidence shows that there isn't an issue, then it's in everybody's interest for that reassurance to be in the public domain as quickly as possible.
Well, Frank, away.
I will, please.
If that information was in the public domain, then the Prime Minister would have been able to answer that question on the GB News interview the Monday before last.
Well, my honourable friend is right that it's in everybody's interest that this information is out there in the public domain to reassure people, or to at least let people know the facts. There's never any harm in giving people information and letting them make their own minds up about what's happening. People's opinions need to be put to one side, and the data needs to be examined in the cold, hard light of day. Otherwise, we're going to be doing harm to people, and we do even more and irreparable damage to trust in public health if we don't. So I hope the Minister will give some reassurance that this data will be forthcoming as soon as possible, and that the government doesn't give the impression that there is something to hide.
Thank you, Madam Deputy Speaker. Can I commend the Honourable Gentleman for Watford for setting the scene? And we have spoken many times about this here, and a real pleasure to see him back to health and strength and very effectively working physically and in this House. The reading on premature death from heart and circulatory diseases is not easy reading, and the British Heart Foundation has made that very clear how stark the situation is. I'm pleased as my party, DUP party, spokesperson on health matters, and I do try to involve myself in all health issues, whether it be questions or debates in this House in Westminster Hall, because that's part of my duty as a member of this House, but also as the party health spokesperson. The number of people dying before the age of 75 in England from heart and circulatory diseases has risen to the highest level in over a decade. Waiting lists for heart operations and other heart procedures are nearly 100,000 higher than they were a year ago. Those figures are stark and worrying, and I'm very pleased to see the Minister in her place, and we've all a great respect for the Minister, and we don't want to burden her with the questions, but really we do have to ask ourselves, why are those figures so high, and what's been done to reduce them? People waiting there are more people over 75 years waiting over a year, and 140 times higher than before the pandemic began. And when we look at all those figures, the worrying figures, the latest figures show that in 2022 over 39,000 people in England died prematurely of cardiovascular conditions, including heart attacks, coronary heart disease and stroke, at the average of some 750 people each week. It's the highest total since 2008. Really, again, worrying figures. They set the trend. They worry us on what's been done to address those issues. This backwards trend, because that's what it is, has been broadly mirrored in age-standardised premature death risks, which will account for changes and differences in population size and demographics. Before 2012, the number and rate of deaths from these conditions under the age of 75 were falling, in part thanks to decades of medical and scientific breakthrough, because there have been lots of things that have happened to try and make it better. But after nearly a decade of slowing progress, recent stats show that the rate of premature deaths from cardiovascular disease have now increased in England for the last 3 years back to back. First time there's been a clear reversal in some 60 years. Again, the question, Minister, is what has brought that about and what's been done to stop it? The British Heart Foundation has said the reasons for the rise are multiple and complex, while increasing pressure in the NHS and COVID-19 pandemic have likely contributed in recent years. The warning signs have been present for over a decade. Well, if they have been present for over a decade, Madam Deputy Speaker, then the question we're all asking is, what steps have been done to slow that trend that there has been there for some time? I know that there will be many in this chamber with opinions as to the cause. I don't hold a medical degree whatsoever. I'm a very simple person, Madam Deputy Speaker, but I do have an interest in health issues, and I do ask the questions. And the causes are the ones that the professionals need to do. But what I will say is that the fact of the sharp rise needs, and it must be better managed. I give some examples of what we're doing back home in Northern Ireland very quickly in the time that you have allocated to me, Madam Deputy Speaker. And we have initiated a developing plan through the Irish Football Association to do with defibrillators and CPR training. It's really important because a number of people who are fit and healthy, and the Honourable Gentleman referred to that there, whenever they do sport and then they find that they have heart attacks on the pitch, those are things that we need to address. And can I commend the charity back home, the Chest, Heart and Stroke, for all that they do. This month in Northern Ireland, and I give a quick perspective of Northern Ireland, 340 people will die from a heart or circulatory disease, and around 90 of them will be younger than 75 years of age. 225,000 people are living with a heart or circulatory disease, and 320 hospital admissions will be due to a heart attack. 130 people will die from coronary heart disease. 13 babies will be diagnosed with a heart defect this year. So those are the figures for Northern Ireland. The stats are shocking when you think of the small size of Northern Ireland. There are an estimated 225,000 people living with heart and circulatory diseases in Northern Ireland, an ageing and growing population, and improved survival rates from heart and circulatory events could see these numbers rise still further. It is clear that this really is a ticking time bomb, and therefore we do seek some help from the Minister here. I can hear the Minister's response formulating, because you're going to say, as we both are glad, by the way, to see that the Northern Ireland Assembly is up and working, and health is a devolved matter. But can I ask, as I always do, and I do this in a very genuine fashion because it's important that we do work together, will the Minister indicate what discussions have taken place or will take place with the Department of Health in Northern Ireland? We are in the situation in Northern Ireland that every region in the UK finds themselves to be in. And there's not enough funding, not enough staff, not enough support, and we across this great and United Kingdom of Great Britain and Northern Ireland need to address the growing problem with solutions. And these can only come with reasonably paid staff and a better system. Let's exchange our thoughts and our ideas, and let's move together forward in a system where we can help each other. An overhaul of the system is what is needed, and we look to the Minister for a plan of action beginning here in this place and extending through and across through the NHS and across the United Kingdom of Great Britain and Northern Ireland. The time that you told me to finish in, Madam Deputy Speaker, I've just done it. Thank you.
Spokesman Amy Callaghan.
Thank you, Madam Deputy Speaker. I congratulate the Honourable Member for Watford on securing this debate on such an important and prevalent issue. He and I have a shared interest in health inequalities, both largely due to our personal experiences. The Honourable Member and myself joined the House at the same time. I remember being sat in this very chamber for his maiden speech where he quoted Sir Elton John's song, I'm Still Standing. I must say, Madam Deputy Speaker, that I'm absolutely delighted that we are both still standing. Madam Deputy Speaker, just a few short months after my honourable friend, and I will call him my honourable friend, his maiden speech, I was in rehab recovering from my stroke. I'm Still Standing was one of the songs we ironically listened to whilst doing physio. A dark sense of humour can be a powerful tool in the face of adversity, but of course we do need to equip people with more than just a sense of humour to get through these very difficult conditions. Madam Deputy Speaker, this issue is something myself and my party are deeply concerned about, with nearly 3 in 10 Scots dying from heart and circulatory diseases, equating to about 50 people per day or 1,500 people per month. Therefore, preventing these deaths, and in particular premature deaths, is something the Scottish Government are committed to. The Honourable Member for Watford outlined the signs and symptoms of many heart and circulatory conditions. I commend him for shining a light on these conditions. We cannot underestimate the impact a debate like this will have. Support for the mind after a health trauma is necessary, as outlined also by the Honourable Member for Watford. For instance, after my stroke, I didn't realise I needed help for my mental health until I reached a crisis point, and getting help was the best thing that I could possibly have done for myself. This support needs to be there for everyone. Madam Deputy Speaker, as we have heard, there are clear risk factors for developing cardiovascular diseases centring around people's lifestyles. Now, we can call these lifestyle choices, but the choices are often heavily influenced by inequality and poverty. We know that people in poverty have poorer health outcomes, and improving people's ability to make healthier choices on diet, smoking and alcohol consumption are essential in changing this. We sadly know that the prevalence rates for circulatory and cardiovascular diseases are significantly higher in the most deprived areas. We also know that poverty rates are higher for some minority ethnic groups, and therefore they are often disproportionately vulnerable to health inequalities. That is why improving health and reducing health inequalities across Scotland are clear priorities for the Scottish Government. especially in the face of UK Government austerity measures. In fact, Madam Deputy Speaker, the British Heart Foundation says there has also been a lack of meaningful action from the British Government over the last 10 years to address many of the causes of heart disease and strokes, such as stubbornly high obesity rates. Obesity and unhealthy lifestyle choices are intrinsically linked to poverty. That's why the SNP's action to mitigate the effects of this Tory government's cost of living crisis are so important to this debate today. Recent analysis from the British Heart Foundation shows that the number of people dying before the age of 75 in England from heart and circulatory diseases has risen to the highest level in over a decade, and we know 700,000 people in Scotland are living with circulatory diseases. We do not know how much this is affected by COVID-19 or other factors, but it is clear that an increasingly unhealthy population plays a key role in these worrying statistics. That is why the SNP's focus on tackling these inequalities and tackling poverty is such an important and proactive step in reducing these premature deaths. The Scottish Government's focus and commitment to tackling poverty and other risk factors relating to cardiovascular disease are despite this Tory Government's austerity measures. The British Government's austerity policies are harming the economies across these isles, driving more people into poverty and making our health outcomes worse. Health inequalities are rampant the length and breadth of these isles. I stand here as proof of that. I had cancer as a teenager and had a stroke in my mid-20s, an indicative example of the health inequalities prevalent in the west of Scotland. Economic austerity is to blame for the slowing progress in health outcomes over the past decade. The British Government would do well to cast their eyes up to Scotland and consider a focus on our wellbeing economy as we do, with people at its very heart. Funding, and in this case the lack of funding, is a political choice. While the UK has considerable wealth, it is shameful that so many are in poverty and that their health is suffering because of that. The levels of universal credit have been too low for too long. The SNP and the Scottish Government continue to call on the UK Government to introduce an essentials guarantee, ensuring that social security benefits adequately cover the cost of essential goods and properly support our most vulnerable people. The Scottish Government has gone to great lengths to increase income for Scots by promoting fair work and improving the value of social security through bold measures such as the Scottish Child Payment and the Real Living Wage. I know we're short for time, Madam Deputy Speaker. To conclude my remarks, I urge this Government and whomever forms the next Government to consider taking the Scottish Government's approach to tackling health inequalities by reducing poverty and guaranteeing that people have the resources to make healthy lifestyle choices. Madam Deputy Speaker, what's abundantly clear is that whilst we are tied to this place, Westminster and the British Government hold the purse strings, any action the Scottish Government take can be outdone by austerity measures from this place. It is only with the full powers of independence will we truly be able to tackle health inequalities in Scotland and reduce the number of premature deaths from cardiovascular disease. Thank you.
Shadow Minister Karin Smyth.
Thank you, Madam Deputy Speaker, and I'd like to thank the Backbench Business Committee for granting this debate and really pay tribute to the Honourable Member for Watford who secured this debate. But I think we would all agree made an excellent and very heartfelt speech, not just about his own experience, but the effect on his family, his team, and his thanks for the British Heart Foundation. And I would agree that the resources of organisations such as them, at times like that, which are often very lonely, are really well received. And we certainly wish him and his family the best of health going forward. And also highlight my friend from Allen and Deeside, who's no longer in his place, but talking about the experience that he, as a member of a family of a young person, also highlighted by the SNP spokesperson, that when we talk about this disease, not only affects all of us here, but our families as well. In 2022, it has been said, an average of 750 people each week are dying prematurely of cardiovascular disease, including heart attacks and strokes, and every premature death is, of course, a tragedy, and our thoughts are with all those families affected. NHS England has reported that cardiovascular disease is responsible for 1 in 4 premature deaths in the UK, and as we have heard, the rate of premature death has risen for the last 3 years consecutively, something we all wish to understand. And I know that many of my constituents and those across the country are worried about the state of heart and circulatory disease services, because despite the best efforts of staff, there is a significant backlog in treatment. The number of people on waiting lists for cardiology services is rising, with a huge 189% increase in the last 10 years. Now, according to the IPPR, waiting times for cardiology treatment have risen even more sharply than elective waiting lists as a whole, which is deeply concerning because long waits mean poorer outcomes for patients, often with devastating results. An estimated 7.6 million people in the UK are currently living with a heart or circulatory disease, and it is vital that every one of these people receive effective and timely diagnosis, referral and treatment. And yet, under this government, the NHS has lurched from crisis to crisis, and far too many patients are not receiving this timely care. Now, we on this side, Madam Deputy Speaker, have an ambitious 10-year plan of reform and modernisation to speed up treatment with 2 million more appointments a year. We want to return to the constitutional waiting time targets within a parliament. As our mission sets out, it is vital to restore the NHS as a world-leading health system, something that we have lost under this current government. The government have promised to eradicate waits over a year for elective care by 2025, and it would be good to hear from the Minister if she can indicate whether they are on track to do just that. We on this side have a mission to reduce deaths from heart attacks and stroke by a quarter within 10 years, so fewer lives are lost to the biggest killers. Under our Fit for the Future fund, we would double the number of scanners, speeding up heart and circulatory disease diagnosis and ensuring patients receive that timely treatment, so vital for managing these conditions. We'll also incentivise continuity of care in general practice, which will improve care in our communities for people living with heart and circulatory disease. It'd be helpful if the Minister could explain why in the last 14 years of this Conservative government we've seen such paltry ambition on cardiovascular care and a decline in cardiovascular health. Now, I know the Minister is probably going to talk about the major conditions strategy, which was announced 13 years into the party in opposite's time in power. But when can we expect the full strategy to be published? And will that strategy explore the reasons for the backward trend in cardiovascular disease that we are currently seeing? Because I would agree with other honourable members, we all need to understand the reasons for that. Now, one of the most concerning aspects of cardiovascular disease in this country is that many of the drivers are higher in areas of greater deprivation and, as we have heard, for black and minority ethnic groups. This is exacerbating health inequalities, and we've heard that from the opposition SNP spokesman and from the honourable member from Strangford about the levels in their communities. Because those in the most deprived 10% of the population in England were in 2022 more than twice as likely to die prematurely from circulatory diseases than those in the least deprived 10% of the population, something I see very much in my own Bristol South constituency. It is utterly unacceptable that across the United Kingdom in the 21st century, particularly given that cardiovascular disease is largely preventable. Tackling those issues which impact cardiovascular health, from obesity to high blood pressure or smoking, is vital, not only in tackling CVD, but also improving population health overall. That is why we have to tackle social inequalities that influence health and focus more on prevention, improving capacity in local public health teams who do so much vital work to improve the health of their communities. Innovation will also be vital to centre prevention in our health service, and I would welcome an update from the Minister on the NHS Digital Health Check trial in Cornwall. Given that results from that trial will inform the rollout this spring, can the Minister indicate any challenges apparent in the trial and when we can expect to see those results published? But as we have heard, prevention starts long before the age of 40, when the health check takes place. That is why Labour will introduce a Child Health Action Plan which will put prevention at the top of the agenda, ensuring the next generation can live healthier lives. There are also widespread concerns that the restructuring of the Office for Health Improvement and Disparities could have a detrimental impact on health inequalities, and it would be good to hear from the Minister her reassurance about how those concerns on health inequalities will be prioritised in the event of changes to that body. Finally, Madam Deputy Speaker, research is crucial to preventing further premature deaths. That is why Labour's Regulatory Innovation Office would make Britain the best place in the world to innovate by speeding up decisions on providing clear direction based on our modern industrial strategy. Alongside a plan to make it easier for more patients to participate in clinical trials, this will deliver better treatment to patients. We owe it to all those families who have lost a loved one to premature death, as well as those who are surviving and living well, we are pleased to see, with this disease. We have to improve outcomes, and I look forward to hearing the Minister's comments on the major condition strategy. But it has to be delivered in tandem with the plan to provide the NHS with the staff, technology and resources it needs to bring down waiting lists and improve patient care, and I'm pleased that a future Labour government has a plan to do just that.
Thank you, Madam Deputy Speaker. And first of all, can I congratulate my honourable friend and say how pleased we all are to see him fighting fit and in his place. And can I also say to the honourable member for Allen and Deeside how we wish his son absolutely all the best and a speedy return to full health. And also to the honourable lady for East Dunbartonshire, who's had so many health problems of her own, and we all wish her very well and a full recovery. There have been some very good discussions and contributions made today, Madam Deputy Speaker, and I would like to just raise a very, very dear friend of mine who died of a sudden cardiac arrest, very unexpectedly, aged 55, a tragedy for his young family. So I really do understand, thankfully not personally, but through very close friends, how terrible this is. And I'd just like to also to add to the honourable members for North West Leicestershire, Shipley and Christchurch that I will write to them about the statistics. I don't have any information today. I wanted to really focus on what the government's strategy is to prevent cardiovascular disease, but I will write to them. And I'd like to, as ever, thank my honourable friend for Strangford for his thoughtful remarks, and to say to him that I've already been in contact with the Minister in Northern Ireland on the smoking bill, and meeting with him will be one of my early priorities. So, Madam Deputy Speaker, my honourable friend is a vocal supporter of the British Heart Foundation, and on behalf of the government I'd firstly like to thank them for all the incredible work they've done throughout Heart Month, including introducing online CPR training that takes just 15 minutes to complete, 15 minutes that could genuinely save a life. And I also want to pay tribute to the many other charities who work tirelessly to support people at risk of or living with cardiovascular disease. Now, over the last decade, the government has taken significant action to prevent cardiovascular disease and its causes. Just over 10 years ago, we launched the NHS Health Check, which is our CVD disease prevention programme. Health checks play a key role in preventing heart disease, stroke, type 2 diabetes, some cases of dementia and kidney disease. The numbers show that through health checks, people have a lower likelihood of being admitted to hospital for CVD and type 2 diabetes, and all causes of death 1, 3 and 5 years after attending a check. So far, well over 10 million checks have been delivered, and data shows more people are now receiving checks than before the pandemic. And we're now investing £17 million into the creation of a digital NHS health check. In fact, we're looking at every opportunity to prevent CVD throughout the course of a person's life. 2 years ago, the NHS published its CVD prevention recovery plan, setting out 4 high-impact areas for every part of the health service to focus on risk factor detection and management. This began by rolling out blood pressure checks in high street pharmacies and helping people measure blood pressure at home. And we're now helping thousands more people detect hypertension earlier. Our forthcoming major condition strategy will focus on prevention throughout the life course, which is essential in creating a more sustainable NHS. It aims to improve care and health outcomes for those living with multiple conditions and an increasingly complex set of needs. We're tackling salt, sugar and calories through the voluntary reduction and reformulation programme. Working with industry, we've already delivered reductions of up to 20% in some foods. Then the second pillar of our prevention plan is smoking cessation, and I'm proud to be part of a government that will introduce the groundbreaking smoke-free generation so that children aged 15 and younger will never legally be sold cigarettes. This will be the most significant public health intervention in a generation. Turning to managing risk factors, once we've diagnosed hypertension, it's vital we properly manage it, and we're doing more than ever before. In people under the age of 80 with GP-recorded hypertension, 170,000 more people had their condition managed to safe levels by March 2023 compared to the same month in 2020. The NHS has set hypertension management as a key priority, investing over £3 million to bring CVD leadership roles within every integrated care board. We recognise that outcomes are often worse in different parts of the country, and understanding why variations occur is critical so the NHS can take the right action. So I support them in their launch of CVD Prevent, a national primary care audit that will provide data to highlight gaps in diagnosis, identify inequalities and find room for improvement. I'm confident the programme will help integrated care systems make real change in their areas. Now, Madam Deputy Speaker, a heart attack is a medical emergency, and recognising the symptoms can be a matter of life or death. People's chances of surviving a heart attack are far greater if they seek care as soon as possible. In August last year, the NHS launched a life-saving campaign helping people to recognise the common signs of a heart attack that are often dismissed or ignored, and to seek help by calling 999. And I absolutely applaud my honourable friend for raising his specific symptoms in this chamber so that others can understand more about what to look out for. Now, around 9 in 10 people survive a heart attack if they reach hospital early to receive treatment, compared to only 7 in 10 people if they don't. That's why raising public awareness is so critical. And then to improve survival rates for out-of-hospital cardiac arrest cases, the government has announced a new £1 million fund that will expand defibrillator access in the community. We've already delivered over 700 defibrillators towards an estimated total of 1,000. And we're also taking huge strides in making our NHS simpler by providing for patients at home, because we know patients prefer to avoid hospital if they can be safely supported in their own homes. So the NHS programme, Managing Heart Failure at Home, is pioneering this approach and addressing health inequalities as a key aim. Thanks to record funding, we're rolling out up to 160 community diagnostic centres, which will provide echocardiography services by March 2025. And I'm pleased to update the House that 153 CDCs are live at this time. Turning now to mental health and counselling services. Yes, I will.
I thank the Minister for giving way. Will she join with me in congratulating the good work of East Dunbartonshire Council in getting so many community defibrillators across East Dunbartonshire to use for these purposes? Thank you.
Absolutely, I'm really happy to do that, and I would encourage all local authorities across the country to make best use of the funds that are available to them. So Madam Deputy Speaker, turning to mental health and counselling services, now I recognise, as my honourable friend has discussed, that surviving a heart attack can have significant psychological impact on individuals and their families, and I'm grateful to him for sharing his own experience so powerfully. So integrating NHS talking therapies with physical health services can provide better support to people with combined physical and mental health needs, including people with cardiovascular disease. Yes, I will.
I think she's making a very important point there, and it shouldn't be a bolt-on. It should actually be part and parcel of the treatment, because what we tend to do is address the physical side of the illness, open the door, away you go, but don't actually ask people about some of those issues that they're really struggling to actually cope with.
Yes, I completely agree with the honourable gentleman. So as part of the NHS long-term plan, all integrated care boards are expected to expand services locally by commissioning NHS talking therapist services integrated into physical healthcare pathways. And I would encourage anyone experiencing symptoms of depression, anxiety or post-traumatic stress disorder, even a long time after the event, to reach out to their GP or NHS talking therapist for support. So to conclude, Madam Deputy Speaker, I want to thank my honourable friend again for raising what is such a very important issue. Right across the House, we all share the ambition to bring down premature deaths from heart and circulatory disease. Specifically, this government aims to prevent 150,000 heart attacks, strokes and dementia cases in the next 5 years. Prevention is not only kinder, but so much cheaper than cure. Thank you.
Dean Russell.
Madam Deputy Speaker, and may I thank the Minister for the response, and to all the contributors today from North West Leicestershire, Shipley, Christchurch, Strangford, and of course the incredibly moving points raised by the member for Allen and Deeside. I wish your son truly the best of health, and he is in the right place in Harefield. And I remember the joy of seeing my honourable friend as well for East Dunbartonshire when she returned back. We were on the Health and Social Care Select Committee when we first joined, and it was a joy when you returned, and I'm so pleased that you're doing so well. Just to finish, as I know I have just seconds to go, I think there were several themes that came out today, one which was raised by several members, which is about transparency and data. And I think the more transparency we have in data, the easier it is to then calm people's concerns. The three outcomes, I think, are about protection, and that's through education as well, and making sure that we protect our society and know the harms that they might be doing to themselves. Focus in on this particular area, and also the opportunities for breakthrough with research. But I would just say thank you again to the Minister. Thanks for the work the government is doing. And I would just say to anybody at home, if you're worried, get checked. If you're concerned that you've got symptoms, get them looked at, because it's better to get rid of your fears before the event than to wait for them to become a reality and then have to deal with the outcomes of that. So thank you, Madam Deputy Speaker. Thank you to all the contributors, and I hope everybody has learnt something from today's debate. Thank you.
Thank you. The question is, as on the order paper, as many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it.
I beg to move that this House do now adjourn.
Just before we do that, I've jumped ahead too far. I beg the House's pardon.